Good afternoon, everybody. First of all, thank you for coming, and I know it was a short notice for all of you. So my name is Dr. Raju, Srinivas Raju Kaladindi. I'm a radiologist. I work for Apollo Radiology International. I'm the CEO and medical director. And we have an education division called ARI Academy, and that's what we're going to talk about. So I trained as a radiologist in India, first in the Nizam's Institute in Hyderabad, and then I moved to UK and worked there for about 10 years and came back and have been with Apollo since 2016. So radiology is a specialty that deals with scans, I'm sure most of you know. And because there has been an improvement in technology in the last 10 years or so, the ability to look into the patient's body using scans is now far better than what it used to be 10, 20, 30 years ago. So that means a lot of the diseases have been are now diagnosed using scanning, imaging, without the need for surgeries and any other invasive procedures. So radiology has become extremely important. Radiologists play a very important role in patient management. So you can see in India now that there are scanning centers everywhere. There are diagnostic centers. Very high-end equipment is being brought into the country. And this is not only in the major cities now, even the towns and smaller towns also have this imaging equipment. But the doctors that read these scans, that are radiologists, the training that is given to these doctors is still not changed much. So we still do a 3 years post-graduation program, like 1960s and 70s, that has not changed. And also the training quality across the country is very variable. There are some really good training schemes, and there are some not very good schemes as well. So because if the doctors are not good, then the diagnosis may not be good enough, and ultimately patients suffer. So we set out to do a lot of things to improve the situation in India and help the other training centers produce better radiologists. So the first thing we did was look into the foreign qualifications. So a lot of our radiologists, after their MD exam in India, try to get UK or US qualifications. The most common qualification they look for is FRCR exam, which is a UK Royal College exam. So to do that, previously doctors had to wait for several years, sometimes up to 8 years, to get a place in the exam. And then they had to go to London at least 3 times to get the qualifications. It was only affordable to a small number of doctors who had the money and time to do it. So we wanted to change that. So we have made several representations to the Royal College and ultimately managed to get that exam center in India. So that is considered to be one of the major benchmarks in the history of radiology in this country. So now we conduct those exams 2-3 times a year. Several hundreds of radiologists come and take those exams. So once we got the center, we now then wanted to look at how to improve the performance of the radiologist in the exam. Because there used to be a difference in the number of people, the percentage of people passing the exam. Those trained in the UK, the more number of them passed, and Indian pass rate was not that very high. So we started preparation courses. So we run an FRCR 2B preparation course. So I request Dr. Dave Roberts, who has been helping us with this course for several years now, to say a few words about the course.
I'll just introduce myself. My name is Dr. Dave Roberts. I was a consultant in Swansea in South Wales for nearly 30 years and retired 4 to 5 years ago. But more importantly, I was an examiner in the Royal College in London for 6 to 7 years. During that time, I was senior examiner. I've also examined abroad in Singapore and also in the Arab Board of Radiology. So hopefully you can see that my background is very much in the examination field. And together with my good friend here, Professor Ash, who also has been a senior examiner in the Royal College in London, we both felt that the problem with Indian radiology was not the knowledge that the Indian radiologists had, but actually the tips and tricks that we could bring to them to actually improve their performance in the Royal College exam. And I hope over the last 5 years, that's exactly what we've done. Dr. Raju has put together a fantastic faculty, and also clearly some of the benefits of the course that we deliver are that we use the same software that is actually used in the Royal College exam. This is the only course in the world that does that. So there are some huge benefits from attending the course in Hyderabad. And ultimately, I think our aim was to produce a level playing field for the Indian candidates. And I think the proof of the pudding is in the exam pass rate, which we have improved hugely. I think I'm right in saying that the Indian pass rate was probably of the order of 30 to 40%. Well, we are now up to 60 to 70%, which is the pass rate for the UK candidates. So I feel that along with the faculty, we have delivered a fantastic course in Hyderabad that has made a difference to Indian radiology. And that is down to Dr. Raju's foresight and his delivery of the course. And I can only thank him for that. Thank you very much, Dr. Raju.
Thank you, Raju, for the kind words. I'll also give a brief introduction of myself. So, I'm an Indian, a Bengali who was born in India. I was brought up in India. I did my initial graduation in Kolkata. Then I went over to UK. And over the years, so I'm a pediatric radiologist. So I do the children are my specialty. But I have been also heavily involved with teaching and training. As Raju said, in the Royal College, I have been an examiner, a senior examiner, chair of the exam board. I've also been heavily involved with setting up the Royal College training. I was part of the curriculum committee who wrote the whole curriculum for the Royal College. I was also chair for professional learning and development for the Royal College. So I have got over the last 15 years quite a bit of experience in how to set up radiology training, how to set up exams, how to set standards in order to make sure that the radiologists who come out of the program are of really good quality. And the quality is important because the patients will then get the benefit out of it. I'm also the professor and head of radiology for Oxford University. So I've got that sort of experience as well. So coming back to this program, so I met Dr. Raju while I was in the college and we exchanged ideas and we felt both of us have got the common passion of doing something also for India. I've done my bit elsewhere in the world, but I want to also, I've got my heart in India, so I want to give something back to India as well. And part of that program is to see how we can improve training in India. The training in India, as Dr. Raju said, is 3 years, where in the Western world, it's a minimum of 5 years. What is the most essential part of that training is something we call as core curriculum or core radiology training. And that is the part when a radiologist get training all around in all the specialties, so they can become a good general radiologist. After that, they can do subspecialty training if they want to specialize. But the core radiology training is the foundation of a good radiologist. And in my view, that is the part we need to tackle initially. So for that reason, we are running this 2-year GRTP program, Global Radiology Training Program. So I have used my experience of creating the curriculum in the Royal College, and I've created a bespoke, detailed curriculum for the Indian trainees. I've also managed to get the best of best radiologists all around the world. They are from UK, they are from India, they are from Middle East, they are from America, like Dr. Kalwa here is part of my faculty. So we have got the absolute best people who are teachers, who are well known internationally, to come and join the faculty, and they are the ones who are going to personally deliver the training. And this training, what we are trying to do is to be not only about the educational content, but also how to talk to patients, how to have clinical governance, all aspects of training we are covering. And what we are hoping that this, along with their DNB or MD program, when they finish it and undertake it, they will become a radiologist who can be compared to the best in the world. And they will have the confidence to go anywhere, join any sort of diagnostic center or a teaching hospital or a university, and they will be respected. But more importantly, they will provide the best care for the country and the people in that country. And doing this in India, we hope that a lot of them will remain in India and provide that care to the Indian population, because they are no different from the population elsewhere in the world. And I'm quite passionate about this, and along with Dr. Raju, we have set all the sort of organization, and I'm happy to say that we are launching this program on the 1st of December this year. So this program is going to start and it's going to roll on, and I hope that all this will make a difference, not only to the radiology training in this country, but for the welfare of the patients in this country.
I'm really fortunate to be here as part of this mini fellowship program. Before I kind of talk about the importance of doing that, just wanted to congratulate Dr. Raju and his team on the excellent organizational effort that has been put into making this a success. And I can clearly see the value of radiology residents in training here in this country availing of this wonderful opportunity. So as you all know, I think imaging or radiology is now the stethoscope of the medical industry. You cannot walk into an hospital and get assessed without getting some kind of imaging. And you need to be highly specialized in terms of looking at imaging. Gone are the days when you had a radiologist who could do head to toe. Now you have to be specialized in certain anatomic areas and provide the necessary clinical information that is required from our colleagues for appropriately treating and triaging the patients. And so I think doing this kind of mini fellowship program exposes the radiology residents in training and also established radiologists to the nuances or the subtleties of what goes into the in terms of doing subspecialty or practicing subspecialty radiology. So I think this would be extremely valuable and beneficial to the radiology community at large here. And again, congratulate Dr. Raju in taking the effort and developing this program, and hopefully this kind of grows and the community at large in India benefits from this exposure.
So I'm Sanjeeva Kalwa. As Raju mentioned, I'm Professor of Radiology at Harvard and the Chief of Interventional Radiology at Mass General Hospital. Interventional radiology is an exciting specialty. We use imaging guidance of CT scan, MRI scans, and fluoroscopy and ultrasound to see inside the body and operate inside the body. So these surgeries are less expensive and sometimes can replace the surgery with better outcomes for the patient. So we need a lot of them in India to treat patients. There are only a few of interventional radiologists in India being trained at big institutions, but many of the small towns do not have enough interventional radiologists to cater to the population. So our aim with this program is to train a lot more interventional radiologists in India through a combination of simulation and outpatient training at multiple institutions to increase the number of people who could serve at small towns and rural areas. And Raj has a great plan about it. I'm very happy to be part of it, and we'll work together to make this a great success.
సో రేడియాలజీ అన్నది మెడిసిన్లో ఒక స్పెషాలిటీ, అది మీకు అందరికీ తెలుసున్నదే. సో మనం సిటీ ఎంఆర్ఐ స్కాన్స్ అండ్ ఎక్స్రేస్ ఇవన్నీ చూస్తూ ఉంటారు. సో అవి ఇప్పుడు ఆల్మోస్ట్ అన్ని రకాల వ్యాధులకి డయాగ్నోసిస్ చేయడానికి స్కాన్స్ అనేది అవసరం అవుతుంది. సో ఇండియాలో కూడా మిగతా వెస్ట్రన్ కంట్రీస్ లాగే మంచి ఎక్విప్మెంట్ ఉంది. ఇప్పుడు సిటీ ఎంఆర్ఐ మోడర్న్ ఎక్విప్మెంట్ తీసుకొస్తున్నారు. బట్ రేడియాలజిస్టులు ఎవరైతే డాక్టర్స్ ఆ స్కాన్స్ చూస్తారో వాళ్ళ ట్రైనింగ్ మనకి వెస్ట్రన్ కంట్రీస్తో ఈక్వల్గా లేదు. మనకి ఆ రకమైన ట్రైనింగ్ ఇంకా రాలేదు. ఒకటి ఏంటంటే మనం 3 సంవత్సరాలే చేస్తాం రేడియాలజీ, మిగతా యూకే యూఎస్లో 4 ఏళ్ళు 5 ఏళ్ళు 6 ఏళ్ళు చేస్తారు. సో టైం తక్కువ. రెండోది టీచింగ్ చేసి డిపార్ట్మెంట్స్ కూడా కొన్ని మంచివి ఉన్నాయి, చాలా మంచి డిపార్ట్మెంట్స్ ఉన్నాయి, బట్ చిన్న డిపార్ట్మెంట్స్లో ఆ రకమైన ట్రైనింగ్ లేదు. సో ఆ ట్రైనింగ్ లేకపోతే ఈ రేడియాలజిస్టులు మంచి డయాగ్నోసిస్ ఇవ్వలేరు. మెషిన్ ఒకటే మంచిది ఉంటే సరిపోదు, డాక్టర్స్ కూడా ట్రైనింగ్ ఉండాలి. సో ఆ డయాగ్నోసిస్ లేకపోతే పేషెంట్ ట్రీట్మెంట్ సఫర్ అవుతుంది. సో దీనికి కావాల్సిన స్పెషలిస్ట్ ట్రైనింగ్ మనకి ఇండియా నుంచి చాలా తక్కువ మంది బయటకు వెళ్ళి డబ్బులు ఖర్చు పెట్టి చేయగలుగుతారు, మిగతా వాళ్ళకి ఆ అవకాశం లేదు. సో మన వాళ్ళు వెళ్ళటం కన్నా ట్రైనింగ్నే ఇండియా తీసుకురావడం అనేది దట్స్ ద కాన్సెప్ట్. మేము దాని మీద పనిచేస్తున్నాం. సో వీళ్ళు అందరూ ఎక్స్పీరియన్స్ డాక్టర్స్ వాళ్ళ టైం యూటిలైజ్ చేసి ఇండియాకి ఏదో ఒకటి మళ్ళీ వెనక్కి ఇవ్వాలి అన్న సిద్ధాంతంతో మనకి సపోర్ట్ చేస్తున్నారు. అందుకని ఈ పెద్ద ఇన్స్టిట్యూట్లో ఆక్స్ఫర్డ్, హార్వర్డ్ అన్నిటి నుంచి వచ్చారు. సో వాళ్ళు మనతో పాటు కలిసి ఇండియన్ రేడియాలజిస్ట్ వాళ్ళు ఎక్కడున్నా సరే డబ్బులతో సంబంధం లేకుండా, ఆర్థిక స్తోమతతో సంబంధం లేకుండా వాళ్ళు ఈ రకమైన ఇంటర్నేషనల్ ట్రైనింగ్ తెచ్చుకుని మంచి డయాగ్నోసిస్ ఇచ్చి పేషెంట్కి బెటర్ ట్రీట్మెంట్ ఇవ్వడం కోసం చేస్తున్న ప్రయత్నం.